you know, if you want to have heart surgery, where do you go? Do you go to a country bumpkin hospital where they might do one, or where they can't do any a year or a month, or do you go to Tampa General Hospital or Orlando Regional Medical Center where they do maybe 5, 6 a day or more? I kind of look at that with this procedure because this is what Dr. Kirkpatrick and I do every day. This is all we do. We specialize in full arch, full mouth reconstruction. We now see more and more people coming in for consults, and they have been around to 2 or 3 places typically. And they've been maybe to a general dentist, maybe to another oral surgeon, maybe to a periodontist. But nevertheless, you know, they've been around and they've been told certain things. And, you know, a lot of times the information that they have been given is not accurate. Like some people are told they don't have enough bone to have implants, when in fact they could have 4 zygomatic implants. I mean, that's an example of that.
Yes.
But out there, it really is kind of a buyer beware thing nowadays. I mean, you've got people like us here. We're board certified oral and maxillofacial surgeons. So we did dental school plus minimum of 4 years in a hospital-based residency, you know, doing rotations on medicine and cardiology and anesthesia and that sort of thing, as opposed to a general dentist who takes a weekend course to place implants, and you might be his first client. So you have to be very careful who you go to see. There's a lot of advertising, and everybody wants to kind of get into this game. So I'll just throw that out there without stepping too hard on anybody's toes, that there are big differences in training between a board-certified oral and maxillofacial surgeon, and there's lots of board-certified oral and maxillofacial surgeons. Not all of them do what we do, and there are board-certified oral and maxillofacial surgeons that focus on trauma, that focus on temporomandibular joint surgery, that focus on head and neck cancer surgery. They do stuff that we don't do, so you know, people find their own little niche. But when you're dealing with board-certified people, at least you can feel comfortable that some standard has been met.
Exactly.
If you go to get a full mouth reconstruction by a general dentist, you don't know anything unless you ask questions about, you know, their experience level. So
yeah, so doing your research, ask questions. That's really making sure you feel comfortable and confident with what a serious procedure that you're going to have.